Okay, well, it's my pleasure to introduce Professor Matthew Ricketson. Matthew is a Professor of Communication at Deakin University, and some of you might know Matthew as a very experienced journalist, worked for the ABC and I think the Age newspaper, an excellent journalist as well as a communications professor these days. And also Dr. Chris Scanlon, who's a senior lecturer in communication.
Associate Professor.
Associate Professor.
Now.
Right?
Now.
And Matthew and Chris are going to speak about the decline of health journalism. Thank you.
And the slow speed of
it says quick access there, and there's nothing quick about this computer.
Yeah. It was fast before.
Well, I will start while things are hopefully cooking. Moss Cass's name was mentioned earlier in dispatches, and as an early influence on the development of Medibank and Medicare, he was also, after he finished doing that, he became briefly the Minister for the Media in about mid-1975, and in that time he put out a paper about the media and how it should be reformed, etc. And it was immediately jumped on, you'll be surprised, by the news media as bringing Joseph Stalin's ideas and other tyrannical regimes' ideas about press freedom to Australia. And so that idea died, and what survived it was the development of the Australian Press Council, that was the industry's fallback position on to stave off the terrible government intervention in the media, and the history of the Press Council is another story I won't bore you with now. But so, all right. Again, well, on behalf of Chris and myself, we wanted to acknowledge the traditional owners of the land on which we're meeting, pay our respects to the elders of the Wurundjeri people, past, present, and to any Indigenous people who may be with us here today. There are two parts to our paper. The first is to look broadly at what's happening to health journalism, and the second, which Chris will be doing, is to go a little bit deeper into how Medicare and private health insurance are faring within this environment. So let me take. Okay. How are we going? Time? Yeah, right. Everybody's getting late in the day. People are leaving. You know, so I'm not taking it personally. All right. I'll try and just give you a brief overview, because I imagine not everybody here is as familiar with the media environment as compared to the health industry and Medicare and so on. But basically, in the last 20 odd years, or even if you go back to 1983, when Medicare arrived, the media was in a much different environment to what it is now. It was pre-internet, with all of that implies, but also the newspapers, the radio stations, the television stations were in a much healthier position financially, and it was very common for the newspapers around the country to have specialist health reporters, or medical rounds people, as they were known. And one of the things that's happened in the changes to the media is that has gradually diminished. The kind of the idea of having enough rounds, whether industrial rounds, sporting reporters, etc. There are a few of them, and one of the things that one of the things that comes out of that is that there is just much less coverage. So this is a snapshot. The ACCC did a big report on the state of the media back in 2019, and one of the things they looked at was various, what you might call bread and butter areas of reporting and journalism, whether health, covering local courts, writing about science, and so on. And they looked at how, over a period of time between it's the early 2000s and 2018, that had dropped off quite markedly, as you can see in the graph. And so what is that about? It's about changes to the business model in the news media, which basically meant by the mid-2000s that the media companies were scrambling to continue to make money, and they basically sacked a whole lot of journalists. Sorry, not sacked, that's not true. They they offered voluntary redundancies, and that is important to make that point, because those voluntary redundancies were quite handsome, well funded, as a result of the role of the Media, Entertainment and Arts Alliance Union, which negotiated good terms and conditions for those voluntary redundancy packages. But so I'm kind of channeling you here a bit, but I mention it because that's important. That's the good side of it, you like, but the bad side of it is that a whole lot of journalists who just left newsrooms, and with them decades and decades of experience. And I'll just crystallise one example. Tim Colbatch, who was at The Age, died at the age of 75 earlier in the year. And he was quite a unique journalist in his own right. But the kind of reporting he did on not only economics in the broad, but psephology and the ins and outs of psephology and seat changes during elections, both in Victoria and federally, has not been replicated. There's no one, as far as I can tell, who's doing that work now that he used to do between the 1970s, and into about 2013 when he left The Age. So what's then happened? Okay, this is work that Chris has done on the ACCC report. Takes us from early in the 2000s to 2018, and then what's happened subsequently, he's brought that up to date, because there is a significant event, and that is the creation of the News Media Bargaining Code, which was as a result of lobbying by News Corp Australia onto the federal government, the then led by Scott Morrison, Malcolm Turnbull and then Scott Morrison, to try and claw back some money from the big tech behemoths, the Facebooks, Googles, etc., and take that money and pour it into the news media. The argument was, you Google, etc., are using all of our content for free. You're freeloading on us, and therefore we want some kind of payment for that. At one level, it's not a bad argument. At another level, it's quite specious, because what had really happened was that not so much the big tech behemoths are stealing journalism; they've stolen advertising revenue. Okay, the kind of money that used to fund Fairfax newspapers, The Age, the Sydney Morning Herald, and so on, that's all gone. Not all, most of it. It's gone to the Facebooks, the Googles, etc. They, in the phrase of one commentator, they built a better mousetrap to get the money from the attention of the consumer to advertising. So what we can see here is that the money that was provided, and it's anywhere between about 150 and up to $200 million a year for several years into the industry. It's kind of been like a sugar hit for the news media industry. It's enabled them to employ people. The big question will be, what will happen when these agreements are renegotiated? And I don't know to what extent you've been following it, but Facebook resisted getting involved in this from the get-go, and only partly got involved. Google got more involved, but the signals are that the negotiation between them and the news media companies will either be, much more or much tougher, less money for the news media companies, or maybe none at all. So we go from a situation where the news media industry gets some money, which they can use to employ people, do more journalism. That's all good, but will it last? I think it's fair to say most commentators think it won't last, and so then you're in the same old pile of doggy doo that you were beforehand. So that's. I'm not going to repeat what's all on there. You can see that for yourself. But that's.
I'm going to click forward for the things that show up.
Oh yeah. What this is doing as we're going through is it's just highlighting some of the particular moments in the last 20 odd years. I think that's it. Is that it?
Yeah.
Yeah. Sorry, spec's not on. Yeah, here's the mid 2012 is when all of the big round of layoffs at Fairfax Media and News Limited happened, as News was then known, News Limited, now News Corp. It's an estimated 700 jobs. That was at one particular time. It's very hard to get an accurate estimate, but it's in the thousands of jobs that went from the main media companies and some of the smaller ones, some of the television networks. And so the drop that you saw in the earlier graph in the number, just the number of health stories recovers. And then I think our final slide shows that, or final of this section shows that they pretty much recovered. Yeah. And so, because what happens in the interim period, of course, between 2019 and 2023, I don't have to tell anybody in this room what happened, but that obviously there was huge interest in stories and media coverage of health issues, COVID, vaccines, etc. So that it's kind of provided a bit of a false picture of what was happening, which is why it's more useful to look right across that 2-decade or so period. And I think I've covered off pretty much on the notes there. So yeah, I'll hand over to Chris now to pick up the second half.
I was just going to footnote that one of the things I was doing when I was thinking about this is, so one of the anecdotal stories I've heard from news organisations is that infusion of money from the News Media Bargaining Code has been mainly gone into new areas of media, i.e. launching things like podcasts, and the ABC has put a lot of that into regional and rural reporting. And, from a business point of view, that probably makes sense for 9 newspapers to go and launch podcasting, even if it's true crime, because you can start to build an audience and then you can use that advertising dollars to cross-subsidise into public interest journalism, which nobody pays for, and nobody historically ever has paid for that kind of reporting. But if and this is really anecdotal, if I go onto the sites of those news organisations, I cannot see, a lot of podcasts. So this is what happened to print, but I can't see new media being used to kind of, cover off reporting. So it's kind of interesting that we've had that sugar hit, but it hasn't really had a big dent in, at least in health reporting, that we've seen so far. And that might change, but I suspect, as Matthew said, Meta and Alphabet are probably going to play hardball next time when they actually come to do deals. And I know that Meta has actually rewritten their algorithm to try and get news as much off their platform as they can, so they can say we don't actually rely on that anymore. So that's a lot likely what they'll do. I'm going to focus in a little bit more now on, so that's the broad picture of what happened to health reporting over that 2-decade period. Focusing on Medicare, and what I did is take the same 12 newspapers that we looked at there and the ACCC started looking at, and looked at a 3-month period in March to June 2023, and just look at how Medicare was reported. And there are a couple of themes that came out in looking at that 3-month period. The first one is that Medicare is kind of failing a little bit. It's either failing or not providing for Australians' health. Second one is it was very much a consumer patient model of reporting. I'll come to what I mean by that in a moment. And then a sort of sub-theme of that consumer model is a very individualised outlook on health reporting. So the first one is that the steady stream of articles mentioning shortfalls and absence of funding. Now, often these aren't really health stories as such. It's Medicare is mentioned in passing. So there's often stories about reproductive health, or some of them are actually about policy, but others are just about kind of, you as a patient might have this particular complaint. What does Medicare cover? But they just mention in passing that, the rebate's kind of there, but it only covers part. So there's a gap, it's kind of failing you, or that there's none. In fact, some of the stories were even about, someone with a child being sick and the treatment not being available in Australia, cutting edge treatment, and then having to go offshore to get that treatment, but that wasn't covered under Medicare. And they sort of mention this often in passing, but the drip over and over again is that Medicare's there, but it's really not up to scratch. And that's kind of that overall. But I can only find in this period one story that mentioned Medicare in an unambiguously positive light, and that was Mary Doyle being elected in the Aston by-election, and her talking about her battle with breast cancer and saying Medicare had been, so important in that regard, and that's a Labor MP. So, that's the only time it was mentioned, as an unambiguously positive light. And so you get that steady stream of articles mentioning shortfalls and the absence of funding throughout. And so these are the kinds of, some of the examples here that we have. The second theme is that tendency to look at health and Medicare through the patient consumer model. And this is from Briggs and Hallis's book, Briggs and Hallam, sorry. They call it the patient consumer model of health reporting, and they counterpose that to the expert, the doctor knows best model, where the journalist is very much sort of sitting there just conveying information as a doctor of authority, from the doctor in the authority position, the audience reasoning passive, as opposed to the public good model. And I don't think there's anything surprising about this. Media companies are trying to build a relationship with the audience. The audience sees themselves mainly as a consumer. Medicare and most government services, I would argue, have been presented to citizens mainly in a consumer frame. So there's not really a surprise that journalists kind of take this model and sort of run with it. But it does, particularly when we're talking about what you were talking about, Carolyn, before, about Medicare as sort of a citizen, and and having that larger kind of public good, that's kind of absent from a lot of this reporting. So I can understand why they do that, because they're trying to develop that relationship and interpolate the audience in that way. But even when you get, and this is a good example of that story, there was a series of stories, advocacy stories around endometriosis during this period that we looked at. And again, the audience is really interpolated in this way as the patient consumer, even when it's a larger issue, and even when the journalists are really doing, and the editorials in some cases are doing more advocacy work on behalf of those people affected, they're really taking still a patient consumer model. Even when you go into a more policy focused area, and the example here is of Medicare rebates for psychology services, which had been increased during the COVID pandemic, and then the Albanese government declined to continue that. So it went from 20 Medicare subsidised sessions during COVID, and then dropped back to 10 when the pandemic was, we were out of harm's way, supposedly. Then the model, we kind of got into this kind of, again, this patient consumer model, where we're going to talk about you as an individual and what you are entitled to. And I think I understand why that's there, but it's also a limitation. And this is where we come to this very individualized model, that even if we want to have a bigger, larger conversation around policy, we can't do it in the newspapers because it's been framed in such individualized terms. So we can't talk about things, well, if you're going to increase, treatment or the time for endometriosis, consultation times or things like that, or expand the number of Medicare subsidised sessions for the psychologists, what would that actually mean for the tax base? What would we have to do to the Medicare levy if we were to make that reality? And we can't have that debate. And you often find this again and again and again, that cannot be talked about. So that's Medicare fares. I just want to quickly look at and compare that to how private health insurance fares. And there was really two themes that came out there. One, strangely, is the private face of public health, and the second one is an innovation narrative. The private face of public health is that private health insurance companies, I can see, and this is only a 3-month period, there were quite a few stories where they had inserted themselves into public health campaigns. And so Medicare, for example, Medibank, sorry, saying, 50,000 Australians have downloaded the app and have signed up for an influenza vaccine. Bupa working with the Big Issue magazine to have their sellers get the influenza vaccine. Private Healthcare Australia inserting itself into the anti-vaping and bans on vaping and seeing themselves and positioning themselves as very much a partner of government in this. So they're kind of like, we're doing the public good, which is kind of fine. There's nothing, you know, they were doing this, but at the same time, if you kind of pose that how Medicare is presented, it's kind of like it's all a bit crap. Whereas we've got these people, and also I did look on the private healthcare companies' media sites, and all of these stories were traced back to very easy to trace back to press releases. So their press release people are very good at getting good news stories in. The innovation narrative is very out there too. Often it's positioned in, we are doing innovative things in the health industry. We're teaming up with hospitals and we're providing in-home care. We're the innovators. You know, we are trying to bring down your premiums by creating innovation. And there's a sort of sub-theme in the background of like, we're not really being allowed to do this. Interestingly, in some of the reports, mainly, one of the stories was about incentivizing doctors. There's another one about private health insurance companies teaming up with hospitals. And in the Australian, at least, there was a question: is this leading us down the path of the American system? And clearly that was being positioned as a bad thing. The same story ran in all the News Corp tabloids, and that question was not posed. It was, this is just a good thing. It's great that they're doing this. Even when there were court cases and there were, legal stoushes between private health entities in the Australian system, they were even presented as, isn't this great? They're moving fast, they're breaking things. And it was kind of, they're disrupting the health system. And yeah, things might get broken along the way, but it's kind of cool that they're doing it. So there was that sort of, even when they'd been fined or something like that, or there was a stoush in, that was the nature of the conflict, it was sort of presented as a kind of a good thing that they're out there doing that. So I'll just end by saying, this isn't new. Nothing has really changed. If you go and look at the previous research on how Medicare is presented, how private healthcare is presented, you can go back to the 1990s. There's papers back to the 1990s which show that these themes are all present, and so they kind of just continue away. So I'll leave you with that. Thank you.
Question over there.
Yeah. Colin Cabot was Public Affairs Advisor of VHA. Chris, I believe you were a lecturer at the time when I was studying media back 14 years ago at university.
Oh, yes.
Yeah, so I'm interested in this sort of idea of like, seems like health reporting right now is focusing a lot on deficit language, like, we're in a crisis and obsession with ambulance waiting times and all that sort of stuff. I understand there's been a bit of a COVID hangover, but I'm just curious, like, you've kind of talked a bit about this already, but like, if we look at other forms of reporting, like even infrastructure, for example, it's less deficity. It's more like, okay, we need a better bus network, for example, but we're not saying that public transport network is in crisis mode.
No.
So I guess, like, why do you think health reporting, other than science-based health reporting, seems to be so focused on this kind of deficit language? Is it post-COVID hangover? Is it all sorts of stuff you're talking about?
I actually think it's longer term. And I think it's interesting. Matthew and I were talking before about, there's a public enthusiasm, and we heard, Catherine this morning, Carolyn, you presented evidence about Medicare actually having high approval rate, and I think the media is out of step with public sentiment. And I think it partly comes back to they don't really want to get into that conversation with their readers and audiences to say, if you actually want to make this better, because there obviously are issues and problems in the healthcare system, but they don't want to get into what would a solution look like, because they don't want to talk about the US system or anything that looks like the US system, because I don't think Australians generally have embraced that, have embraced private healthcare. But also, they don't want to, what would that actually mean? Maybe we'd have to look at the Medicare levy. Maybe we'd have to look at the tax base and revenue. Maybe we'd have to shift, what we do and don't cover. And they don't really want to broach that conversation. So I think by default, they're left with the deficit language.
Just the only thing I'd add, I agree completely. I'd just add that it also goes to fewer people around with the kind of long-term expertise who will feel comfortable and be able to say, we need to have a conversation, or not conversation, let's write some pieces or do some stories which are about the complexities of this debate. I mean, the housing issue is the other stunning, obvious example. No one, I mean, you might have read Alan Kohler's quarterly essay. That's one of the first things that's actually start in the broad public domain to start actually saying, this is not just our cost of living issue. There's other things. There are structural issues. That we have to pull all sorts of policy levers to change things. And if you're not having that discussion, nobody knows about it. And the same thing I think is happening with healthcare, because yes, of course, there's issues in Medicare. It's 40 years old. Everybody starts to creak and groan a bit at 40 years old. So it does need changing, but we're not having that debate. And there are people who could, you know, journalists who could and should.
Thank you. Yes.
Yes.
I must have to spend time. I teach health communication to public health students at Deakin. The world's changed so much. So thank you for your analysis. And I think it's we can reflect in all sorts of ways of how journalism has changed. I don't think the media has really very often been the place to have these type of iterative or trade-off debates. And I think the issue is not supply, the issue is demand. And we're not turning the radio on. We're not watching the news. We're not following these stories. And that's an increasing trend since COVID that we're seeing in Deborah Lupton's work and elsewhere. So we're seeing a real switch off from the traditional media.
Mm.
So the challenge that you bring, which is like a really good place for us to end, is where can we have the type of public discussions that we need to have about reforming Medicare? And I don't have the answers, but I'm interested. Is it on social media? Doubt it. Is it in deliberative environments or citizens' juries? Or where is this space that we can have the discussion about reforming Medicare as is necessary as it grows?
It doesn't need reform at all.
Or it doesn't, maybe it doesn't need reform.
Yeah.
Well, I don't think many of us in this room believe it doesn't need reform. I think we all think that it needs to grow.
No, it's a really good.
Political space to have this discussion.
It's a good and hard question in the sense that, I mean, you mentioned social media. I mean, social media was originally sold to us as a way to have these kinds of conversations. But if you have recently dipped your toe in that toxic sludge of a river, then it's kind of not. There's so much other shit swirling around. Even if you were putting that stuff in there, it would just it's very hard to kind of separate that from all sorts of, you know, what's the Taylor Swift conspiracy theory that's going around? I mean, you know, what a bonkers idea that is, and yet that's everywhere at the moment. You know, I mean, yes, I don't know. It's the short answer for me.
I think the conversation, you know, I think the quarterly essay, I think, is a good vehicle, but it's only getting out to a certain demographic. And I do have some residual hope for social media. The problem with social media and the way in which the big platforms are working is that, you know, it's like the difference between Instagram and TikTok. Instagram, you used to go and say, these are all my interests, and plug them in, and then it would serve you up content. TikTok just works out what your interests are and will serve you more of that. And Instagram is now going to that model. It used to be Instagram was a curated, you know, place where you curated your own interests. TikTok works out your interests and serves it back to you. So unless you actually show an interest in that content, you're never going to see it, because the algorithm is never going to serve it up to you. And so I do get, you know, a really great stuff on TikTok, and, you know, people talk. I saw the Australian Institute, the comments from the press club there this morning, you know, and that was the first thing that comes off on my TikTok. But I know that's because it's worked out my biases and they're going to give them back to me. So the tricky thing is, how do you get out to that audience? And I think the only answer I have is all in the above. You have to have all the conversations on all the platforms and keep flooding them. And that's a really hard task.
Right. Well, we're going to keep moving on. So thank you very much.
Go ahead.